argument per person. We'll start on the pro side. We've got a few minutes for each side. So this side of the room, I will observe that there were many tables that really wanted to argue on the other side, which I think is part of what a debate does, is actually force you to think about both sides, and I think that's good. But arguments in favor of this perfectly correct proposition. So, Ray.
So I think you always have to define things, and if you define social return on investment, I think, and I'm sure everybody had to define that for their table. So if you think about social return on investment as sort of the population health need in a very simplistic way, I come back to the model where we said there was population health need, demand, supply, and education, and there were some market failures. And those nested in there is the social return, or the need for a social return. So there's market forces, and the private sector and other sectors will naturally migrate or be attracted to market forces, but who will look at the market failures unless public funds do? So that was one argument in favor, that it is the public funds and public subsidies that
somebody needs to care.
Somebody needs to care.
Yep. Other arguments from this, the right side of the room. My right.
So
left. Yeah.
Correct side? Is that what you
So we kept it simple and built on the previous one, which is the opportunities for that social return are huge, that Anne laid out. And actually, let's be clear, the risks are enormous if we don't. You know, so if we don't invest public funds in addressing those issues, that's good. Social return, let's make it human. We went back to Kansas. You know, so the sense it has to be fair. You know, a real sense that if it's public money, it's got to be fair. It's got to reflect. You know, what do I get for spending my tax dollar? And that just strikes me as being so powerful on a human level.
It's kind of ethics and justice, but also huge risks and upside in the future.
And guess what? You won't get that investment done if you don't demonstrate that accountability.
Yeah. Great. And then this table had an extra argument or comment?
Well, we felt that in favor of this, that certainly it would incentivize change to occur, and we also took the time to define social return, much as others did as well, in terms of meeting the needs of the community, because otherwise, you know, the alternative is you can provide funding, much as the earlier debate, but no change in the systems will occur. So we felt that we were in agreement with this because it was an incentive for changing the system of how we educate.
I'd like to do something different than what we're doing now. Good. All right, the con side. Yes, sir.
Well, we probably had the easier task because, you know, the prosecutor has to do this beyond a shadow of a doubt, and all we have to do is sow doubt. And so I will start out with the concept of the tyranny of social return. It's impossible to measure. If you can measure it, it can only be done over the long term. And public funds that flow into these institutions flows on a continuous basis, not the same amount, obviously, but what's your baseline? How are you going to judge whether somebody is doing social return, however you end up defining that? We don't think that's possible to define. So as a result, this proposition can't possibly be lived up to.
Edmund Burke would be happy with you.
Thank you.
So what we thought is it's a very quaint and naive notion that you could even make this proposition, which is preposterous on its face for the reasons that we've already heard. But in addition, no matter, you know, first of all education has a return to society, all education, no matter what. And the moment that you start adding these extra conditions on it, then no matter how you define it, you will drive behavior to accommodate that, so that people will say, oh yes, if that's how you define social return, that's exactly what we do. And who will be the best at being able to do it? Here's the perverse outcome of this, is those schools and those institutions that have the most resources. They will get the best marketers the best lobbyists to demonstrate how they're meeting exactly your definition, no matter how you define it. And it doesn't matter. So the schools that are perhaps doing what you really want to have happen, which is to provide health care that meets an unmet social need, those tend to be those institutions that have the least resources. So the schools that graduate the cardiologists, the neurologists, the radiologists, and those things that have all those resources, they're going to be the ones who are going to game this system better than anybody else.
Go ahead.
We all said amen. And we would add to that that by going into this proposition, you're putting the concept of social return and the goal of education into the political fray. Because what one person might define as a social return, another might not. Does family planning education have a social return? Some candidates in the current election would say yes, and some candidates would clearly say no. So now, how do you, as an organization, game the system, which you will, in order to meet what is a true social return, which is inherently a political debate?
And then switch with the next thing. So, good. Yeah, comment from the...
Whoops, if my mic is on, that you could also, in terms of defining social return, look at the ability to stimulate the economy through private entrepreneurial action as another means of social return. So it's all in the definition.
Great. So why don't we open it up to comments from the floor now? And we've got maybe 7 or 8 minutes for comments. We'll go over on this side.
Yeah, I just want to give
This
up.
deeply conflicted side over here.
Yeah, I was scooting over to the other side. But just as an example of the way this gets twisted, you know, I'm working with the integrative health and medicine communities. There was a point in the 90s when suddenly there was money. And at that point, medical schools that had been looking down on, denying, and dismissing all of this started up integrative medicine programs to take up all of the money that came into that, and those people who have been in those fields didn't get the money and were getting less and less actually to this day. And so exactly what you've described has took place in that, right?
Tricia? Bjork?
I'm wondering if we change that to social and economic return. Just, you know, I think that it is how it hits my pocket, and you know, and I just want to challenge again. I'm kind of coming from the frame. So we use that term population health a lot, and what we know across this country is that we have places of very, very, very dense population that doesn't get a social return, but we also have places with very sparse population, and the sparser the population is, I don't think that's a word, but they tend to think when we talk pop health that that's who we're talking about. And so I think it is about economic return. So, you know, am I going to be able to get the services that I need, not paying more and more and more, paying on the front end and the back end?
Economic return to individuals or to society?
Both.
Both. Yeah. Good.
Because when you use that term, social return, it comes back down to the individual, as they said, but it really is pocketbook sometime.
Sue, and then I'll come back over to this other side.
Thank you.
This is general.
Two things. One is, I think I had the most trouble with the fact that public funds would go to institutions. I don't see institutions as agents of change. If we would have said to communities, give the money to community, and community decides what they're doing, or individuals, that we recognize the
Follow the
individuals
leader.
for their accountability, where you can track that better than institutional accountability. So I say that. And then for both propositions, I was very much reminded of the fact that at the U.S. we're out of bounds in terms of the amount of money we're putting into healthcare, health professions, education, as opposed to the social determinants of health tell us put the money into the social side and you'll get healthier communities. It's hard for me to justify putting more money into a place that's not really returning value on health.
Bjork, and then we'll go over to this side.
I just wanted to dispute the claim that you cannot measure this, because it's actually being done. There is, and in a couple of months, I'm actually going to a conference where the focus will be measuring the social return on investment of health workforce education. And it's hard to measure, but there are some low-hanging fruits. And I think it's actually been demonstrated, and I know it's harder to do with institution, but if we want real change, we need to make institutions become change agents, and that has to be done in collaboration with community. So you can look at where do the graduates go. You can look at is the research, not that it's published, who cares? Is it changing policy? Is it changing health? Where do we've seen, for some of our studies, we've seen that actually we've compared graduates from our two schools in the Philippines with other more traditional schools, and you can start seeing both health behavior changes. The patients are better educated. They're more likely to deliver in a healthcare center. So you can measure it. It's hard. It's not going to be, a randomized trial, but it's something where you can start build the evidence. So I think we should strive towards that, and whether that's perfect or not. But I think you have to, again, social return meaning economic return. And who do you ask what that should be? It's communities. You start to ask them, what do you value about it?
Thank you. And it also implies the data systems necessary to track those things and to measure those. Over on this side.
I think that our excellent presentation this morning and a lot of our discussion have been rooted in traditional economic theory, and I also wanted to suggest that we may gain additional insights if we incorporated behavioral economic theory, and that some elements of psychology and some of the newer modeling would help to also gain a deeper appreciation of human behaviors that we observe but maybe are not quantifying.
Good point. Somebody else, are you going to speak? You have the microphone in your hand. Okay. Other comments? Erin.
So I'm actually very pro social accountability, and I'm working on this in North Carolina, as Warren knows. But I'm struck by the fact that in North Carolina for the last 25 years, we have studied where our medical students go after graduation. For 5 years later, we track that. And we find out, in fact, that 2% of our medical students end up in rural primary care in North Carolina. We've been putting this data out for 20 years. So just because you have the data doesn't mean you can actually affect change. We are doing some of that, we hope, in North Carolina around admissions and around, but I also want to caution us to say, even if you have the data and you have a data system and you're in nirvana in terms of research, you may not actually be able to connect those data because people will still behave irrationally.
Every so often they rationally. All right. Why don't we close there? If all of you could vote on this proposition, public funds should only go to those health professions education that demonstrate a social return on investment, as stated. Some nice clarifications, but we'll just take that proposal. Yes, no, no maybes, and hold up, and the only thing between you and lunch is voting. I will vote anonymously by saying I am in favor of that proposition. Although the issue of the other side, yeah, that's why we wanted this. Yeah. 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 Of course, you're right, 100%. No, of course. But for the debate propositions, there's this crafting of what the statement is so that it's a reasonably, yeah. Of course. Of course. One was the votes. Got it? So before we announce the vote, and a drum roll, please, I really would like to thank all of you for your participation this morning. We know and learn a lot more by working together, and I think that came out in everything we've done this morning, but including the debates. I really want to thank Patricia and Ann. It does take actually a certain amount of courage to come up and argue, particularly if you don't agree with it. Why don't we show the votes then? So 2/3 of the House argue against going in some aspect of that has upset them. Health professions, education institutions that demonstrate. Reflections on that? And I think that the pieces on the con side that where people were talking about were, all right, how do you measure social return on investment? The point that Sue made about does it go to the institutions or individuals? I think gaming the system, and many of us in the room have gamed the system for years. You know, in the sense of, and your comment about you change it, and then the institutions that do it well, do the grant process well, shift around, and I think there's a lot of justice to that. On the pro side, this is an incredible opportunity. If we don't do anything, there's an opportunity cost, since we're using economic language today, of what will happen if we let the Titanic continue heading towards the iceberg. And that it's just the right thing to do, I think, is the other elements. A lot of nuanced comments. Thank you all. You have an hour for lunch. Come back at 1. Thank you.